Currently underway at CHOC is a program that studies why adolescents ages 15 to 19 get different cancers than other age groups. Dr. Leonard Sender discusses the findings.
Adolescent cancer program is taking children really from about the age of 13 to 18. And recently the National Cancer Institute has defined that adolescents and then young adults are an underserved population in terms of the progress that we've made in how we treat that group of kids. So there are unique biologies of different types of cancers that they get compared to the younger child or the older child. There are interesting psychosocial questions that we have to deal with. There's family issues that we have to deal with. There's pubertal issues that we have to deal with, which change the biology. So it's a unique group of patients that we need to put more attention to. We have not made progress in curing them. We've made great progress in curing kids 0 to 14. Great progress in curing people, actually older people. But when you look at the survival of the group that's sort of in that adolescent, we've actually had a decrease in survival. We have not made any improvement in 20 years. So that's why it's a big focus. We've been very successful in getting kids up to 16, 17 years of age. It's at that age when we start seeing the drop-off, because the child or the parent believes that they don't need to be seen by a pediatrician, or they don't want to see them in a children's hospital per se. So what they're doing is they're going to the internist, the family practitioner, or the emergency room. It turns out that more kids don't have any health care at that age. So one of the things we're doing is doing a massive outreach to our community, to every aspect of where people enter into a healthcare system to do it. What we're doing is a study that we're going to be doing, which is called Barriers to Access to Care, trying to understand what the barriers were, why children did not present to the appropriate institution in a timely manner. It turns out it's not that they don't just get to us, they may get to us late. We need to educate people to take symptoms seriously, investigate them, find a way to get these children and young adults to the physicians appropriately, and make sure the referrals are appropriate. We can't look at a family in the eye and say, your kid went to an adult facility, which may have been a good facility, treated with therapy that gave them a 39% chance of being alive at 5 years. If they would have been treated on a children's cancer protocol, they may have had a 68 to 69% chance of being alive. That has obviously its implications to society are immense, and we need to study it. And then we need to study it. Is it just because the treatment plans were the same, or that they were adhering to them, or there are other issues? So we don't want to be arrogant and say we know the answers, because we don't. We need to study it, and the way to do it is in centers like what we do. I think this is a field that's still in its infancy, even though it's now starting to get attention. People are focusing on it. They start to focus on which new drugs we should try. But as the eternal optimists, we've got these 395 new cancer drugs to come out in the next 5 years. The answer lies in one of them, but the answer lies in studying them and studying our kids and making sure that we actually utilize our patients well to solve the problems for them and the future generation of kids. So it's an ongoing process, and we're making slow progress, but no progress yet in that group.